Thank you very much, and good afternoon, colleagues and Honorable Minister. Yes, the, the health service is also very excited about what you've just said. It means that we're going to have improved access to care across the country. I'm here with Director of Public Health, Dr. Citi Queen, Dr. Bedusa Akode, a consultant public health person with the Ghana Health Service and the program manager for API. So if there are any other questions, they may be called upon to respond. We'll be talking about updates on selected diseases in West Africa. That is the two new viruses that is threatening Ghana, the public health actions that will be taken, and those that we are currently being taken. Then we get to the overview of the COVID situation, what is the travelers, airport issues, our schools, and then have a discussion with COVID-19 outbreak. But reports have been coming from Guinea that there's Ebola and then Marburg disease in Guinea, and now the Ebola has moved from Guinea to Abidjan in Ivory Coast, which is quite close to Ghana. The COVID-19 situation in West Africa is still high but fairly stable. Ghana's situation remains quite high. Our active cases is still a little over 6,000. The schools outbreaks are decreasing and the number of active cases are coming down. On the 9th of August 2021, the authorities in Guinea confirmed the case of Marburg. This is the first time the Marburg virus has been detected in West Africa. We have it in Central and East Africa. The patient in Guinea did not survive. I think they have also isolated about 155 people who were under observation. The same town, I don't know how to pronounce it, Gukedu, where we found the Marburg, is the same town that we found the 2021 Ebola, and the very same town that the 2014 and 2016 West African Ebola outbreak also started from. The Marburg virus is a highly infectious disease that causes what we call hemorrhagic fever. And it's very, very similar in its presentation and behavior like the Ebola. Yesterday, the Ivorian, that's the 14th of August, the Ivorian Health Authority reported a confirmation of an Ebola case in Abidjan. The worry is the fact that it's in Abidjan, which is about 4 million population, and so that can easily spread and affect us. The initial investigation found that the patient had traveled to Côte d'Ivoire from the same Guinea by road and arrived in Abidjan on the 12th of August. Currently, the patient is on admission and receiving treatment. So what are the signs and symptoms for us? They are quite similar, very, very similar if you look at the list. They all come with fever, body aches, headaches, bleeding, and other abdominal pains and gastrointestinal diseases. So it's quite a similar presentation, and in all ways, how it is contracted and how it presents. They are all from animals to man, and we have the bats, the monkeys, etc. are the key areas where we can. So processing meat, etc. is something that, as we have discussed, should be very, very careful. How do we manage them? We manage them with most of them don't have any definitive treatment, so we have something to reduce their fever, hydrate them. We have vaccines available now for Ebola, but we don't have any vaccine for the Marburg disease. For the Marburg disease, there's no vaccine and any definitive antiviral treatment for that. So that is an area where we need to be very careful. and the Ghana Health Service and their partners have initiated systems. We already, since the onset, we've submitted structures that are in response, that all our rapid response teams, our border porters have been alerted with the fact that we've had both Ebola and Marburg. Alerts have been sent to the regions and the districts about the Marburg preparation. The Ebola one will be leaving today, but we already have some discussions with all our regional leaders to ensure that they start preparation for that. The good thing is that some of the interventions that are currently in place are also can also be used to respond to this. Ghana has the capacity to diagnose. Noguchi can diagnose both the Ebola and the Marburg disease. And public education and sensitization already has been initiated, including what we're just doing. We are going to help strengthen the regional information sharing through the West African Health Organization and emergency operation through our emergency operation center, which is currently very active. So we'll be sharing and getting to know exactly what's happening in all parts of West Africa and know how to respond. We are going to heighten the public health surveillance across our borders, especially the western border, where we have Côte d'Ivoire and then countries where we've discovered the virus. Currently, the border is closed. We just have to make sure that for those who can enter legally, the necessary checks are done. And also make sure that illegal entries are prevented and all checked. So we are currently collaborating with the Immigration Service to ensure that these things are sorted out. We are equipping our port health staff to ensure that they can screen and look at that. We know we already have the health declaration forms for which we used for Ebola and now we updated for COVID. It will tell us where you are coming from, where you have been the last 2 weeks, and even you enter Ghana, where are you going to stay? In states you have been found to be an exposed person, we know where to find you. So those systems are currently in place, and all regions will be asked to ensure that they do the necessary follow-ups. So that's it for the new viruses, and if there are any questions, we will answer them during the question and answer session. So where are we with our COVID? As of the 12th of August, which is the last report we have, our total confirmed cases is risen to 111,232. We have so far done about 1.52 or 1.53 million tests with about test positive of 7.3%. Out of 101,000, 104,000 have recovered. We have so far recorded 930 deaths. And if you realize that at the beginning of this surge, we were doing about 810, 817, you can see the total number of deaths that has been recorded in this short time. Our active cases has dropped from 6,900 to 6,004. So I'll give you the details. So I can see the next chart. You can see the first wave, the second thick wave. If we are lucky, this third wave may not be as big as the second wave. But we need to ensure we can only be small or be less than the second wave based on what we and you do. So you can see that the 7-day moving average has seen a downward trend, that the number of cases reported are generally declining. And that means that we need to continue doing more so that we can even rapidly bring it further down, because we're still recording sometimes 400 plus cases. The number of the hotspots and both active cases and the total number of cases remain the same. Greater Accra, Ashanti, and the other sister regions like Central, Eastern, Western, and Volta now also showing some relatively higher number of cases. Savannah, Upper East, and Northeast still remains, and Western North still remains regions with relatively low active cases. If you go to the next case slide, we can see that In the second wave, we peaked at about 8,000 plus active cases. Well, as we got about 6,900, we have seen a decline in the active cases. So let's pray, but also work hard so that the chart continues to come down. You can also say that if you look at compare with the number of cases we're getting in Accra and Kumasi in the second wave, we are not getting the same high numbers. What it means that the vaccine is also making a difference in what we are doing. When it comes to the schools, so far, a total of 453 schools have recorded cases of COVID-19, with a cumulative total number of students who have reported positive is 3,113. 95.6% have recovered. We still have about 136 active cases. The last time we were here, we had about 504 active cases. So that outbreak in the schools seems to be under some control. I'm sure the protocols and things have been, the schools have started adhering to the protocols. But we have 49 cases still in Ashanti. OT has 40, Water has 21, Bono East has 10 cases, Greater Accra, incidentally, had only 6 active cases. Western 4 have 3, and Eastern region has 3 active cases of school children who have been lost. So far, we've not had any mortality apart from the one we reported, who was a sickler and also had that. Volta region has recorded the highest number of cases, especially in schools, but 2 systems have been put in place. Teams have been sent there. Teams will be sent there next week as well to go and see how we can support the region in its response. Northeast has still not reported any case in their schools, ever. At the airport, as at 9 a.m. on the 15th of August, that is today, the total cases, a total of 128,000 people have been tested. Males account for more than 2/3 of the number. Ghanaians are 40% and non-Ghanaians are about 60%. The month of July recorded the highest number of cases among the international arrivals since we opened the airport in September 2020. So if you look at it, you can see that's the highest peak. So it was no wonder we had a lot of complaints because the numbers were high. And that's also a reflection of what was happening outside the country. So far, in August, we have 142 cases, and the numbers have actually come down. Now we are reporting under 29. Yesterday it was only 9 out of the nearly 2,000 who were tested. Okay, so that's for the airport. Now the vaccines. Last week, probably exactly a week today, we received 177,600 doses of J&J vaccine received from the AVAT, the African Vaccine Alliance Trust, for which, as an AU platform where governments are paying for the vaccines to be delivered. So these are paid-for vaccines. In line with our epidemiology and the challenges we have, we will continue with our focus of our deployment in hotspots. This will be based in 11 districts in Greater Accra and Ashanti region. It tells us that once we consider those, if you saw the chart we brought, all the viruses are being harvested and shared from Accra and Kumasi. So until we quell that fire, it's going to be difficult to address the nationwide. Anytime you see any case outside, you can always trace it to these 2 sites. And so we still continue to focus there. So the national and regional planning and training has been completed on the 11th of August. The regional and districts are going to do their own on the regions did their own downstream training on the 12th to 13th. Because this is the first time we are doing Johnson & Johnson, we have to do the treatment and the training. People have to know what is the side effects, the size of the bottle, how much you should draw, etc. And so that is always there. Anytime we get something different, we need to do a refresher training, especially the one that involves the vaccine. So in the Ashanti region, we're going to do a Kumasi Metro, Kwadaso, Forikrum, and Asukwa. And I'm sure if you follow the report on the chart, you can see why they have been chosen. Greater Accra Metro, Ablekuma Central, Denta, Okakwe North, Tema Metro, Pon Katamanso, and Gas South will be the area of focus. We believe that is where not enough people have been vaccinated, and it also shows that we are also having some outbreaks coming from there. And so if you can able to quell that fire, we also reduce the transmission significantly. So as a way forward, pursuing additional vaccines, the pipeline is richer than before. Approximately 600,000 AstraZeneca is expected within the next 2 weeks. So those who are waiting for their second dose will all be covered, and we'll have even extra to start people with a new one. We are expecting 1.3 million Pfizer, BioNTech coming, and then 1.2 million Moderna. Moderna, we have dates, but as soon as it's confirmed, we'll let you know. But it will be very, 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 very soon. We've also 16.9 million doses of Johnson & Johnson. It is from this lot that we have received the 177,000. And so this is 16.9 minus the 177,000 is what we are expecting. And I think if they come in but as quickly, we'll be able to go ahead of the virus. So what is our outlook as far as the public health emergencies are concerned? The outbreak of Marburg and Ebola in the West African region presents some challenges to the public health system in Ghana. And so we are going to have to respond to ensure that not only our land borders, even our sea borders, the fishermen who go around and fish and come back, we are activating all the surveillance system to ensure that they are taken care of. Fortunately, for this, fever is a major presenting feature, and all our borders can take temperature routinely. Our active cases remain slightly above 6,000, and we need to do more to bring it further down. And I believe that a lot is going on. That's why we have seen the 7-day moving average show a dip for the past 1 or so weeks. So we strengthen our surveillance at the ports of entry, particularly western border. Our community-based surveillance and volunteers will be activated to look out for any signs and symptoms of Ebola and Marburg. Rumors of people who have come in from places of concern will be following them up. Our fisher folks will be one of the key areas to be consulting because they go around fishing and coming back. And like I said, we are currently engaging immigration and all other agencies at the port, at the borders of entry, to assist us in policing and ensure that we are able to identify anyone. Adherence to the protocol is very happy and very good, and I think we must also thank the regional ministers who have stepped up to support in ensuring that some adherence is somehow enforced. We need to wear the mask appropriately. We continue our social distancing, hand washing, and then the enforcement must be by all. Even if you can't do anything, just make sure that anybody who comes around you is wearing a mask. I think that's all we can do. Anybody around you should be wearing a mask. If everybody can do that, everybody will be safe. Honorable Minister, thank you very much. And those who, when you get a vaccine, please, don't run away. Go for it, please. Thank you very much.
Doc, I'm going to take questions at this point in time. Forgive me, I stepped out briefly, but I don't know if you spoke to the subject. How do we, or do you have a mechanism for ensuring that people who have taken a 1-dose Astra don't end up coming to take J&J is what is going next, right?
Honorable Minister, I've asked this question before. I say, if we share our arsenal, those who are determined to do that will find out. But we have ways of identifying.
Okay.
Just that the information is that we are not sure about the safety of mixing vaccines. We are not sure about the efficacy of what comes out of you, so don't. But for those who try it, we have systems in place to be able to identify and then take them out.
So the Ghana Health Service is admonishing persons who've taken one Astra that don't come looking for J&J as a top-up, because they do not know and they cannot assure you that it will be safe for you to mix. You are safer of waiting for your date for Astra and taking your second Astra, and those who are going this lane will also go this lane. Time for your questions.
Honorable, even in the next 2 weeks, we are getting about 600,000 AstraZeneca. So all those waiting for their second dose should wait.
Thank you. Thank you. It's important to make these points so that those who may be contemplating it are well advised. So we'll start from here. There was something I studied in school called deviant behavior. So you always have people. Yes, sir. So can I see those who have questions on this side? 1, 2. So let's start. And then we'll go this way.
Dr. Abuaje, I just want to find out how worried should we be in terms of this Marburg and then Ebola viruses detected in other West African countries? How worried should we be with that? And secondly, at what point would we begin getting the vaccines extended to other regions aside the Greater Kumasi and the Greater Accra regions? Thank you.
Yes, thank you. My name is John Awuni Kesben. I'm not trying to belabor the point again on the AstraZeneca, but there's this question that just came up. I understand initially it was supposed to be 12 weeks before the second jab was to be taken on the AstraZeneca, but it's elapsed. The 12 weeks has elapsed. So those vaccines that are coming, the 600,000 or so that you mentioned, will it be effective if those at the 12-week elapsed, they go for it? Will it work effectively for them? And secondly, at the early stages, Zoom Lion was contracted to do this mass disinfection exercises in the schools, public places, markets, and lorry parks and whatever. Are you considering contracting them again to do similar now that the schools are experiencing some hikes in the COVID cases? Thank you.
Thank you. Nana?
Yes, Doc. Lactating mothers and pregnant mothers, can they take the dosage at this point? And then would you advocate for restriction on West African countries that have had Ebola and the Marburg virus so that they do not come and infest? Because apart from closing the borders, we have porous borders. People can just sneak in and then come and infest us. Would you advocate for complete restriction of movement of West African countries who are having this problem? Thank you.
Doc, please, some persons have cast doubt on government's ability to attain the herd immunity by the end of the year. We want to find out, with the level at which the vaccines are coming in, what are the plans to ensure that that particular agenda is accomplished? Secondly, what are our chances of having the Marburg virus into the country? Like you stated, the Ghana Health Service is worried and you are intensifying interventions. What is Ghana's chances of having it into the country? And there have been issues from the airports regarding the travelers, the extortion. The other time, the Ghana Health Service released a statement debunking some of the allegations. I want to find out, is government interested in further investigating to find out if indeed there are some forms of extortions at the airport testing center? Thank you.
So I have two questions. The first is a post from a doctor on Twitter yesterday about treatment centers being full. We want to know if our treatment centers are full and what is the state of the number of ICU beds we have. That's the first question. The second one has to do with, we are seeing more cases on a daily basis, but active cases are reducing. Are these?
I didn't hear that.
I'm asking about active cases going up. Okay, the number of cases that we are recording daily going up, but our active cases is down. Are these deaths or recoveries? If you can reconcile that for us, thank you.
Doc, let's take responses.
Thank you very much. How worried should we be? Yes, we should be worried because now people move very fast across countries. Someone can get into the Accra in an hour or two from the same places. So yes, and that's why we have put out the alert and that's why we are also strengthening the borders, our systems at the border to screening, both at the airport and everything. So we are, but the advantage is that our borders are closed, and so that gives us some control to check those places. So that is what I would say, that we should be worried, but worrying is not a good strategy. We need to ensure that we put in the systems that will help us quickly identify and isolate should anybody come in so that it doesn't spread. And I think that's what our work is mainly to do. First is to prevent them from entry and then identify them early and I take them. The vaccine, we are still doing, there's some equity in the vaccine distribution. Even though the major focus is going to be on where we have epidemiological, we are still reserving some from other hotspots in the other regions. And so it's not going to be just only even Accra, it's not everywhere in Accra. In Greater Accra, it's not everywhere in Ashanti, but we still have a strategic stock that is going to be used to respond to other hotspot regions across the country. Unfortunately, we are expecting a few more vaccines in the next few weeks, and so that should help us. And answering that, I want to just use the whether our target. We can deliver, it's about the vaccine. And it's not the fact that the government is not trying. If the vaccines come in, I can assure you that in 1 month, we can vaccinate 20 million people. If we have vaccines today, we can vaccinate. Last, on 2020, we vaccinated 6 million people in 4 days, nationwide. So what we need to do is ensuring that we get a vaccine. Once we get a vaccine, we will. If you look at the stocks that we've shared, that means that obviously Johnson & Johnson is a single dose, and if they come in as planned, we should be able to cover a large ground. So let's all work towards that. And it's not only about government giving, it's also about people taking. And so we need to ensure that there is no hesitancy, and that all those who are due take the vaccine, then the target can be reached. So the media also has a big role to play in assuring people that this is very, very safe. For the 12 weeks that has elapsed, vaccine, I'm sure you followed, when we said AstraZeneca, I said the next dose is 3 weeks, right? Then they moved to 8 weeks. Then they moved to 12 weeks. This is because we're still in the process of working and learning. We also know that at least for 6 months, for 1 dose gives you protection. And so what is it about vaccine is the time interval between. What you can't do is you can't take the booster before a certain time because you not get the appropriate response. But the next booster is quite open. And so with the 6 months, they are still protected. You may have some reduction in antibody, but once you get the next dose, you still respond appropriately and get a bigger, probably a better boost. This disinfection continues in the schools. Once there's an outbreak in any school, one of the response after the isolation and treatment and whatever we do, one of the main intervention is also disinfection. So, for example, Achimota was disinfected, all portion of it. Schools that get outbreak get disinfected, and so disinfection still remains. But it's not the mass one that we did before school reopened, where all schools were screened. But once there's an outbreak, one of the responses to disinfect. Lactating mothers can take the vaccine. While we are not certain, we don't have evidence that it's safe for pregnant women to take. So pregnant women are still not being vaccinated, and children under 12 are not being vaccinated. In fact, those 12 and above is only for Pfizer, for which information is available that is safe. So pregnant women no, but lactating mothers can take the vaccine. Banning countries, I really don't think so. Fortunately for us, our borders are closed. And so we still have some control as to who comes in and through the port. And so we will look at how the outbreak fans out in Ivory Coast and Guinea, and depend on the outbreak. But for one case, Guinea has not reported any other follow-up cases. So we are watching us. So our advice will be based on how bad the situation is and how exposed are we. So travelers at the airport. Well, I mean, people have made all manner of allegations, most of which are really false. Some of them are retweeting earlier tapes, etc. But if someone took your money, you should also provide information for us to go and look for. But if you just make speculation that someone took my money, I don't know where we're going to start from. But there are systems in place to check. And if someone really took your money, you can know. We know who is on duty at any particular time. We know there are any shift, you know who is on duty. So if you can say, someone in this booth at 2 o'clock took my money, you will know. But until you give us that information, that will be quite difficult to do. Our treatment centers. Yes, there's a lot of pressure on our treatment centers. No doubt about that. But as people get discharged, spaces are created, and that Ashanti initially was bad. It's a bit improved, and so it may be good today, may be bad tomorrow. But that's the more reason why we want to ensure that people don't catch the virus, and also no matter what you do, if we don't protect ourselves, all our beds will be full, and we'll not even have enough health workers to manage them, because the health workers will also go home because they are exposed. Yes, you asked the mathematical question of why is cases going up. You see, when we are looking at active cases going down, subtracting and coming down, so you may be subtracting a higher number 14 days ago and adding some number you think is high, but not as high as what you are subtracting. So that is what is happening. So it's the number of course, those who have recovered plus and those who have died is the number that affect the total active cases. So that's what we see, because we've had some 300. In fact, don't bother so much with the ones that are delivered today. Look at the moving average. That's the one that gives you the real figures as to the sample, when was it taken. It may come out 3 days later, but one may be coming out. So with that, moving average gives you a more relatively, and the chart also tells you based on when the sample is taken. I think those are the questions, Honourable Minister.
Dr. Patrick Umabaji, thank you for your time this afternoon and for the update. Colleagues, are there any further questions? Thank you, Doc, for your time and for the updates that you've provided us with. There's a hand. Oh, please. Wound to me. Yeah, no, I'm son of you.
Doc, with a quick one. New virus here, which is a Titru Guinea, no Nipa do one Ephraim.
Say isolated 155 contacts.
Osha Hodia COVID-19 the buyer na any dear ebe no. Yahu boase or my minim say what can say your borders in Bibra ya tutum. And so ye ni buyer so ana COVID-19 no. A peja ni mu kakra wo ye memu ha. We no. So in case say ekoba say e biaba minim say ma de but yahu boa ene de edi kamba no sen netie e na wo hwe schools outbreak no so a wo hwe number na say ekosoro na aba from kosoro a ɛba sɛ yɛ nsusu sɛ awofoɔ no na yɛde hu kakra ɛba ɛsiane sɛ ɛhu sɛ schools ahodoɔ no ɛkɔ soro kakra no na ɛsuro ɛhɔ nso deɛ na moyɛ soronko a nka ɛhɔ cases no koraa deɛ ɛbɛba sɛ ɛbɛtumi aba fam koraa mekyerɛ schools no ɛwɔ yɛ mmaa mu ha sɛ nka deɛ na yɛyɛ a ɛbɛtumi ahwɛ sɛ schools cases no ɛnkɔ soro koraa ɛbɛba fam ama ɛsuro ɛwɔ awofoɔ bi no mu no ɛtumi aba fam ɛda ase.
Thank you very much. Me start free. Me first free schools ne there no. Say we school no any numbers nya okruma. Say school kra no safe kra chain. Baby if say school for about 11 million no. Inti so nya active case of 136 which means say kitikiti kra. Nso so ho de nam say high adventure say send your mother no nti no. Say ba kokoro room a etimi sign obia in a short time but when him say school no so my idea teacher for na abo modern say be ya nka under normal circumstances adan cross wa nkwala affected no edoso e chen aha enti ebobo hu modern be che say continue Ghana education ya adwuma say be ya protocol say dey akire omo no senior siko dining hall me enko assembly ye course sports enye say akwara bi ho ye hia we ni ye nya edidi so se na ye na ye betimi aye sa ne man so ho nti na enya bi a etimi hu no senke nhye ni ho a nka akwara benya bobi ehu ni bi hu an se na nka asan obi a Marburg ni aye na de metima che se ahombo e wo mu sese no eye chen 2014 time ba kono ba ye no but adwuma no say yensi ye twa amanaba na ya ne say ye si ho kwan e ma ne mba enti emfa ne say obi ba na si ehunu say tene aba ko plane bi twa mu ko Nigeria na obi timi omo te plane mu yom si Ghana nyina no ye quarantine mo be 21 days and then 14 days and 21 days aha sans she nyina beba obi anso wo krom ha bia wo wura krom ha bia bebu sa say he na ofri bae then now chiminu ya obamu ehe na he ne fa no wako ye ni nyina ebehunu say we high risk and also when you high risk we high risk ebehunu kwan be fa so a ebe follow up ni a chese okofi kura na tenefi kakra mempia anto se bia na otweme nsa bi twema nso mapie san hyehyɛ ne wo ho ebe san ahye mu kena na ede abo ho ban.
Doc, I want to thank you for your time. Colleagues, we'll draw down the curtain here. And I think on Wednesday, we'll have an opportunity to re-engage on some other matters. Thank you.